So we come to the next classification, which is classification of the dialysis membranes according to their flux, that is their capacity to remove water, water permeability, as well as the mass transfer area coefficient. You can see some terms like MWCO, which is molecular weight cutoff. You can also see the water permeability, and you can see the sieving coefficient. Sieving coefficient significantly tells us whether beta-2 microglobulins can be removed or not, and whether albumin is removed or not. We want beta-2 microglobulin to go, but we do not want albumin to be removed from the body. And finally is the pore radius. So we have low flux dialyzers, which are commonly used today, high flux dialyzers, which are used mainly in hemodiafiltration and other situations, medium cutoff and high cutoff membranes. Okay. And last is the classification according to the efficiency of the dialyzers. Remember, I told you that KOA means mass transfer area coefficient, in which removal of urea is estimated. And if urea removal is less than 500 ml per minute, then it is known as a low efficiency dialysis membrane. And this is commonly used today. There is also something which is 500 to 700 ml per minute, and that's known as a moderate efficiency dialyzer. And then comes the high efficiency dialyzer, in which more than 700 ml per minute of urea is removed. So in this graph, you can see that as the urea clearance is increased, this is a higher efficiency dialyzer. So when do we use a low efficiency dialyzer and when do we use a high efficiency dialyzer? A low efficiency dialyzer is used usually in patients who are of smaller size. Like I said, the body surface area of the Asian populations are sometimes smaller than those of the Western populations. And so we can safely use low efficiency dialyzers. But in patients which are very large body surface area, then we need to use high efficiency dialyzers, where the blood flow rates also can be increased to 400 ml per minute, more than 300 ml per minute, definitely. And we can also increase the efficiency by increasing the dialysate flow rate from 500 ml per minute to 800 ml per minute. Of course, we must remember that there is caution to be used, and you cannot always dialyze patients with 800 ml per minute flow rates.